What are the symptoms of a root tear of the meniscus? Hey, this is Dr. P. I get asked questions all the time about meniscus tears, specifically root meniscus tears. So the meniscus is the shock absorber cartilage in between the thigh bone and the shin bone of a knee. And meniscus can tear in a lot of different spots, but a lot of times you'll get this tear like a bucket handle tear where it'll flip back and forth and the person will be getting locking, clicking, popping, snapping, mechanical symptoms. The root tear is where the front or the back edge, usually the back edge, attaches to the bone. And it's like a root of a tree. It attaches the meniscus to the bone. And so when that tears, a lot of times it's not flipping back and forth and you're not getting mechanical symptoms. And so sometimes we're like, oh, is there a tear there? Is there not a tear there? The radiologist can't tell for sure. And patients always ask me. And I say, well, the only way to know for sure is to go in there and look, which is surgery. And sometimes people don't want surgery. So sometimes we'll do an MRI arthrogram where we inject magnetic dye in there to see if there's really a tear there or not. But really the only way to know is to go in there and look. And if it is torn, it can be no locking, no mechanical symptoms, and it can fake you out. It can be more sinister and more insidious. Usually it's just pain and maybe some swelling. So we think it's maybe not as bad as it really is. And a root tear can be worse than a regular tear if you don't take care of it. But the key is figuring it out first. And a lot of times it's actually going in there and looking, and a lot of patients don't want to do that.